Non-surgical rhinoplasty, liquid nose jobs. Make sure to follow my blog at bostonbeautyblog.com.
A surprising number of people, myself included, don't like their nose. Many people are uninterested in surgery. It's painful, there's downtime, and there's always, of course, the unknown. Surgery is the only permanent solution. However, Botox and fillers can change the angles and shape of your nose, usually to give you a pretty good outcome so that you still look like yourself, but the little things that bother you are a little bit more perfect. An ideal nose has certain angles and is in certain relationships to other anatomy of the face. And while I don't do surgical procedures, I do specialize in the non-surgical. By adding volume, you also can change the aesthetic appeal of the nose. Remember, the eyes work by refracting light. So if you have any bumps or divots in your nose, it's going to increase the look of the shadowing and imperfections. So by smoothing out the nose and changing the way the light reflects off of it, not only will you look better in pictures, but you will also look better in person.
When light reflects off an object and hits the retina at the back of your eyes, an electrical signal is passed to your brain, and your brain interprets the signals as an image. When light bounces off a smooth object, it reflects at the same angle as it hit the surface of the object. When light hits an object that isn't smooth, it reflects in a different direction. This is called diffuse reflection. Clinical evaluation of facial aesthetics is performed by assessing symmetry and proportion of facial features. Horizontally, dividing the face into thirds, and vertically, the face is assessed in fifths. Ideally, the height of the nose should measure the entire middle third of the face. The width of the nose should measure 1/5 of the face. Geometrical angles also play an important role in facial aesthetics. Evaluating the face in profile, the nasal frontal angle should be between 115 and 135 degrees. The tip of the nose is assessed by the nasolabial angle, where the columella meets the lip. The nose, basic anatomy. The intersection of the frontal bone and the two nasal bones is the nasion. The dorsum is also referred to as the bridge of the nose. The point the nose starts to change in elevations is the supertip. The highest projected point of the nose is the tip. The columella divides the two nostrils.
In a rhinoplasty, tissue is removed from the nose and bones are set so that they will heal in a more aesthetically pleasing way.
Adding volume can change the angles and pattern of light reflection, creating the optical illusion of a smaller, more perfect nose.
It is really hard to get good before and after pictures of somebody who's doing their nose. First of all, because it's the middle of your face, most people don't want to be in a before and after picture.
In order to provide the best visualization, I am using stock photos and my poor Photoshop skills. A dorsal hump is a convexity to the bridge of the nose in the profile view. The nasofrontal angle is greater than it should be. By adding volume to the dorsum, the convexity of the bridge disappears, and the nasofrontal angle measures more acutely and within the range of ideal. The profile of this woman's nose is drastically improved by adding volume to her bridge. Impressions are dents that are visible in the profile of the nose. Because the surface isn't smooth, light reflects in a different direction, making the nose appear imperfect, especially from the frontal view. Adding volume, the dents disappear, the surface is smooth, and no longer does diffuse reflection occur. The light now exhibits specular reflection, which actually makes it appear smaller. Even crooked noses can be made to look more straight. Similar principles apply to crooked noses. By adding volume and altering light reflection, there is the optical illusion of a straight nose. There are several techniques that are used to lift the tip of the nose as well.
The best part about a non-surgical nose job is how happy people are afterwards. I've never seen so many people cry over such a small change in their face.